name is Ryan Murphy. I'm a student physical therapist assistant from Jefferson State Community College, and today I'm going to be talking about Pseudomonas aeruginosa. So you may ask, what is Pseudomonas aeruginosa? It is an opportunistic bacteria that can range from being either life-threatening to benign. It is nosocomial, which means that it is hospital-acquired, but you can also commonly see it at a skilled nursing facility. It likes to grow in moist areas, and it commonly targets people who already have a weakened immune system. It's very hard to treat due to the fact that it is antibody resistant and certain medications have to be prescribed. Someone at risk of acquiring P. aeruginosa includes anyone with a catheter, wounds, burns, someone on a ventilation machine, or someone who has come in contact with an improperly chlorinated pool. To diagnose Pseudomonas aeruginosa, the bacteria must be isolated to determine the strain to know that it is Pseudomonas aeruginosa or a different type of Pseudomonas. The doctor will then run lab tests to reinforce that it is Pseudomonas aeruginosa and begin prescribing medications to fight back. Medications such as anti-pseudomonal drugs are prescribed since the bacteria is antibody resistant. Prognosis of Pseudomonas aeruginosa is determined by how weak the immune system of a person is compared to how strong the strain of Pseudomonas aeruginosa is. If someone with a very weak immune system comes in contact with the infection of Pseudomonas aeruginosa, it could be very bad news for them. It also depends on what part of the body has been affected, whether it's the respiratory tract or there's a wound present. If it's the respiratory tract that has been infected, it could take up to 2 weeks for the medication to actually kick in and start working. The wound depends on how large the wound is and how deep it is to determine where the infection is at in its stage and how long it's going to be there. So how does P. aeruginosa affect the body? It starts by attacking small arteries and veins and then occludes them with a thrombus or hemorrhagic necrosis. These can lead to problems such as sepsis, dissemination, and bacterium, which is a worse form of bacteria. All 3 of these things can ultimately worsen the infection in a patient and just mean bad news. Since P. aeruginosa is a hospital-acquired illness, it can be spread by contact. The MD will need to run lab tests as mentioned and possibly take a physical examination of the patient to see how far along the strain is and what needs to be done. And again, he will prescribe those anti-pseudomonal drugs. Prognosis, again, depends on the severity, the location of the body, and it could take up to 2 weeks for the medication to kick in. So, the common sites of infection include the respiratory tract, which is commonly seen for those people with a weakened immune system, such as someone with pneumonia, COPD, chronic bronchitis, or cystic fibrosis. And this is commonly due to the fact that there is fluid buildup in the lungs, and that moist area is where the Pseudomonas aeruginosa likes to live. There is a possibility of lung damage and fibrosis for someone who already has cystic fibrosis due to the mucus blockage. Another infection site is the CNS, which is your brain and spinal cord area. The CNS infections result in the locations of the sinuses, such as your paranasal sinuses, your ear, or your mastoid. It can result in symptoms such as fever, headache, stiff neck, and nausea. Another form of the CNS infection includes the ear, such as swimmer's ear, which is actually a benign side effect of Pseudomonas aeruginosa. The third type of infection is skin and soft tissue infections. This includes wounds, burns, trauma, and the wounds typically allow for sepsis to thrive, only again worsening the Pseudomonas aeruginosa. There may appear to be a bluish-green coloration to the wound bed or the burns, excuse me, and there's typically a foul or fruity odor. So these are just some pictures that will show you what Pseudomonas kind of looks like in these types of scenarios. So this picture right here is a lung that has been removed, and you can see the little bright spots. That's where the Pseudomonas has grown and attacked the lung. This picture right here is a picture of a lower leg. It's an open wound, and it again also has that bluish green color, and typically it would also have the foul, fruity odor. This is a picture of swimmer's ear that has kind of gone a little too far, which is also again a Pseudomonas aeruginosa symptom. And this is just a diagram of where on the body Pseudomonas aeruginosa can attack. So it lists the skin and soft tissue, respiratory tract, the CNS, and it even mentions the urinary tract, because as I mentioned before, those with catheters, typically urinary catheters, are at risk of contracting Pseudomonas aeruginosa. This could also lead to a UTI, which is a whole other damaging effect. So there is a practice pattern for Pseudomonas aeruginosa. Since Pseudomonas aeruginosa can infect wounds, burns, or pressure ulcers, it is categorized as practice pattern 7C, impaired integumentary integrity with partial thickness, skin involvement, and scar formation. When skin breakdown occurs, it could have an effect on sensation, which is important for a PT or PTA to understand for when they use modalities, because if they can't feel something such as electric stimulation or heat, you could possibly burn or hurt them. On the Nagy disablement model, P. aeruginosa falls under the functional limitation category. This is due to the fact that the disease can integrate into the body when somebody is already in the hospital for another reason. This may result in a longer stay in the hospital, meaning a longer time on bed rest. If someone is in bed rest for a long time and maybe not getting the proper care of movement every 2 to 4 hours, they could produce pressure ulcers. As mentioned before, a pressure ulcer is also another risk for catching Pseudomonas aeruginosa. Functional limitations may also occur due to contractures, which are secondary to pneumonia, and that causes low ventilation and then maybe decreased wound care. So there are ways that we can manage symptoms as physical therapists and physical therapist assistants. We address many things such as wound care, patient education, teaching someone how to breathe, and the proper cleansing of devices. So for wound care, there's debridement, drainage, healing, and you just really want to keep that wound clean, and that kind of also falls into patient education, teaching them to understand the signs and symptoms of what an unclean wound may cause. You could also use a high volt electrical stimulation for wound healing as part of your physical therapy treatment. There's also patient education, again for wound care, and then also how to be aware that your machines may not be clean or they're acquiring a lot of fluid or moisture, which is again another area for Pseudomonas aeruginosa to grow. You also want to teach a patient how to breathe, such as the pursed lip fashion, which is in through your nose and out through your mouth, just like that. A manual therapy technique that we could also do are percussions. You can do this to the back or even the chest in a certain position to help with someone with a respiratory tract infection get sputum up. You also want to make sure if they do have any sputum that you measure and document it. There are other ways that we can manage it beyond physical therapy, just with our prevention of the spread of the disease. So one main thing you want to make sure you do is have proper hand washing skills, because it can commonly also get up under your nails, which when you shake someone's hand, turn a doorknob, you can easily cause a spread of this disease. You also want to make sure that you are using your proper PPE, such as gloves and gowns, and maybe even with wound care, covering your eyes with goggles. Ventilation machines or urinary catheters are also hosts for P. aeruginosa to grow, again because of the accumulation of moisture. It's important to clean out any machines and make sure that hot tubs, high boy, low boy tanks, and swimming pools are properly chlorinated so that the spread of this disease cannot be continuously spread. This has been my presentation on Pseudomonas Aeruginosa. If you have any comments, please leave them down below. Thank you.